Hi, my name is Abdul Razak. I am a performance specialist and an auditor. Welcome back to my channel. If you are new to my channel and if you wish to know more about virtual scribing, then you have come to the right place. In this channel, we talk about virtual scribing in a very simple language so that everybody can understand. If you are planning to join the virtual scribing industry, then you have come to the right place. Today we are going to talk about a soap note. In this soap note, we are going to talk about chief complaint. Chief complaint is a concise statement of symptoms that cause the patient to seek medical care. Chief complaint is usually entered by a triage nurse. So let me give you an example. Sometime in the past, you probably have visited a doctor or accompanied some relative or a friend to a doctor's office. When you enter and see the doctor in his room, the first question the doctor would ask you is, "What brings you here?" And you would answer, for example, headache. "Doctor, I have a headache." So here the chief complaint is headache. Let me give you a few more examples of chief complaint. Chest pain, abdominal pain, fall, fever, dizziness, or emergency room follow-up. Emergency room follow-up is, for example, the patient probably had some acute complaint. For example, he had a fall or he had sudden dizziness and had to be taken to the emergency room. There the patient was given some treatments, had some tests done. Now the patient is visiting for a follow-up visit. So these are different chief complaints which are written in the patient's own words. Based on the chief complaint, a medical report is created, including chief complaint, history of present illness, review of systems, physical exam, assessment and plan. It is very important that a medical report has chief complaint. It is a must. It is a requirement. A medical report should always contain the chief complaint. Not always a patient visits a doctor with a complaint. For example, someone would visit a doctor for a medication refill. A person would require a medication, or probably they would visit a doctor for a follow-up visit. For example, I visited a doctor 2 weeks back when I had injured my arm. I probably had a fall 2 weeks back and had an injury. I visited the doctor 2 weeks back. The doctor gave me medications and told me to come after 2 weeks. So I go and visit the doctor after 2 weeks. That is a follow-up visit. Here the doctor would note my progress or any worsening in symptoms. So this is called a follow-up visit. Chief complaint is also called reason for visit. Reason for visit would be follow-up visit or medication refill or annual visit. Usually chief complaint is in the patient's own words. For example, I have a headache, I had a fall, I have dizziness, etc. Mostly chief complaint is entered by the physician's assistant or a triage nurse. A scribe is not responsible for the chief complaint, because when a patient visits a clinic, the patient has to inform about his chief complaint to the nurse or the physician's assistant. If for any reason the chief complaint is not entered in the record, it is your responsibility as a virtual scribe to confirm this with your physician. So to conclude, chief complaint is a concise statement of a patient's problems. It is a must and it should be included in the medical record. Chief complaint is preferably in the patient's own words. It should not be more than a single phrase. Remember these things. In the next video, we are going to talk about history of present illness. If you have any comments, if you have any questions, please write down in comments. And if you like the video, please share it with your friends and subscribe to my channel for more informative videos like this on virtual scribing. Thank you.